The horrific top story that we've been covering all morning of 2 children dead and at least 17 more people hurt after a gunman opened fire during a back-to-school mass at a Catholic school in Minneapolis.
So Health and Human Services Secretary RFK Jr. joins us now. And I know we're all watching this together, Mr. Secretary, and wondering how we would prevent it. And we're still trying to get a lot of answers to a ton of questions. But the one thing is clear. You are dealing with a person who's trans, that was transitioning. Are you going to be examining at all some of the drugs that are used in order to make that transition happening, to see if it plays a role? Because we also know there was a trans shooter in the Tennessee situation.
Yeah, we are doing those kind of studies now at NIH. We're launching studies on the potential contribution of some of the SSRI drugs and some of the other psychiatric drugs that might be contributing to violence. You know, many of them on there have black box warnings that warn of suicidal ideation and homicidal ideation. So we can't exclude those as a culprit, and those are the kind of studies that we're doing.
So I've never seen that medicine, but you're saying that if you get it, some of the side effects could be homicide, suicide?
Well, there are black box warnings on some of these psychiatric drugs that warn about, in their clinical trials, that they saw suicidal and homicidal ideation. So, you know, we are going into that with an open mind. We're looking, a lot of these studies have not been done in the past because of HIPAA regulations, which protect the privacy of patients. But it's something right now that we are looking at. We need to look at it, and we need to explain why all this violence is happening, and we need to look at every possibility.
Right. So obviously you have a lot of things at play, whether it's the SSRIs or just the profound mental disease that is affecting a lot of these people. And obviously we have endured a lot of these shootings over the years. What can be done about the HIPAA regulations so that federal authorities can get around that and actually examine the bodies and do forensic analysis of some of the mental diseases that go into this?
We have the authority to do that. We need IRB approval to do those kind of studies, but we can get to that data. It has not been done in the past, and we need, you know, this kind of violence is very recent. It's a new thing in human history. There was no time in the past when people would walk into a church or a classroom and start shooting people. And it's not really happening in other countries. It's happening here, and we need to look at all of the potential culprits that might be contributing to that.
Secretary, the CDC director was fired after refusing to resign as her lawyers accuse you, sir, of putting millions of American lives at risk as a CDC vaccine chief slammed in a resignation post. What are your thoughts on that, sir?
Well, I'm not going to comment. It would be inappropriate for me to comment on a personnel issue. What I will say is, you know, President Trump has very, very ambitious hopes for CDC right now. CDC has problems. You know, we saw the misinformation coming out of COVID. They got the testing wrong. They got the social distancing, the masks, the school closures that did so much harm to the American people. Today on CDC's website right now, they list the 10 top advances, the 10 greatest advances in medical science, and one of them is abortion. Another is fluoridation, another is vaccines. So we need to look at the priorities of the agency. If there's really a deeply, deeply embedded, I would say, malaise at the agency. And we need strong leadership that will go in there and that will be able to execute on President Trump's broad ambitions to restore this agency to gold standard science and to what it was when we were growing up, which was the most respected health agency in the world.
So this is what the attorney said. When CDC Director Susan Menarez refused to rubber stamp unscientific, reckless directives and fire dedicated health experts, she chose to protecting the public over serving a political agenda. For that, she has been targeted. So she says you have a political agenda. Deborah Horry, the chief medical officer, has resigned. The infectious disease director, David Jennings, I think, has resigned as well. Is this something that's caught you by surprise? What's your reaction to people that are getting a little worried?
I think that, no, it has not caught us by surprise. Again, I cannot comment on personnel issues, but the agency is in trouble, and we need to fix it, and we are fixing it, and it may be that some people should not be working there anymore.
Yeah. Sir, can I ask?
Go ahead.
What's the biggest challenge that you're facing in implementing Donald Trump's, vision as a mandate by the American people to make the American communities safer and healthier, sir? What's the biggest challenge you face?
Well, one of the things that we were going to talk about on this show is our newest initiative to try to get the medical schools to start teaching nutrition. Right now, only about 15% of doctors say that they feel competent to give nutrition advice. 7 out of 10 Americans die from diet-related diseases. So, and you can reverse up to 50% of diabetes cases just by changing the diet. And yet we have a medical community that is writing prescriptions largely and doesn't even feel competent. So we've gone to the medical schools, we've gone to the MCAT testing companies, and we've gone to the accreditors and said, we want to see real nutrition classes taught at every medical school in this country. Typically, even medical schools that say that they have nutrition classes or opportunities only give you about 2.5 hours during your entire medical school.
Wow.
And we want our physicians to be able to give dietary advice and nutrition advice to their patients and not just rely on the pharmaceutical paradigm.
It seems like such an obvious answer, maybe the most obvious thing that, what you eat is going to have an effect on your health. Why do you think that medical schools are slow to understand the importance of that?
I think a lot of them are catching on, and so we have not encountered a lot of resistance from this. There was some resistance from the accreditors and the testing companies, but I think we are close to reaching an understanding with them.
All right. I also know the next month you're going to announce what you think is going to be the cause of autism. And you say there are certain interventions that are causing it. Is there anything else you want to say to the people that are wondering why we're having this blitz of autism in America?
Autism rates in 1970 in this country were less than 1 in 10,000. And the biggest epidemiological study in history was done that year in 1970. And it validated and confirmed many other studies, similar studies at the same time. So we've gone to the CDC announcing that 1 in every 31 Americans has autism. It's probably actually worse than that because California, which has the best data collection system, reports that 1 out of every 19 kids now has autism, 1 out of every 12.5 boys. This is a crisis. There is not a single cause. There are many. There's an aggregation of causes.
Okay.
And we are now developing sufficient evidence to ask for regulatory action on some of those, or at least recommendations.
Mr. Secretary, it's an extremely busy day for you. A lot of change going on, and you're also moving at 100 miles an hour, like everybody in the Trump team. Thanks so much for joining us today.
Great to see you.
Thanks for having me.
Want even more Fox News on YouTube? Become a Fox News Patriot today. Click join to find out how.